Ralph Massullo, who represented Citrus County in the Florida House from 2016 until he was term limited in 2024, is now seeking a return to public office, this time as a state senator. The Citrus County Chronicle sat down with Massullo to discuss his plans and priorities.
30th. Ralph, thank you for taking the time to be with us.
Thank you, Mike.
And here are a few questions.
Thank you.
First, as a former state representative and small business owner, how will you leverage that experience to effectively serve rural and suburban constituents across Citrus, Hernando, and Sumter and northern Pasco?
Well, that's a complicated issue, as you know, because there's so many different aspects that are involved in service. But as a business owner, I've seen firsthand some of the issues and problems that we have. And most of those are related to our growth. Being experienced in the legislature, I understand how the process works to be able to craft policies that work for us, balancing what we have with our infrastructure, the needs of our people, and to be able to meld those two together in such a way that we have balance. And that's really the key in everything that we're trying to obtain, is a balance. Works for our community, works for our environment, and best serves the people.
Okay. And with chamber and industry endorsements, businesses clearly see you as a pro-growth candidate. How will you balance pro-business policies with the needs of working class families and affordability concerns?
We have to look at what we're facing today in our state. Florida continues to be growing, which is a beautiful thing for us. We have a very winsome state. People move here primarily because of the climate. They move here because of the cost of living. They move here because of the freedoms that Florida affords them. And they're going to continue to come. And so we need to make way for them to come in such a way that it doesn't disturb the way of life that many of us wanted to have when we first came here to begin with. And that has to do with preserving our environment. One of the biggest priorities that I had when I was chair of state affairs was to make sure that we had the wildlife corridor in place. Commissioner Simpson has done a great job in continuing with the rural lands program, putting more land under conservation to where farmers could actually use that land, to herd cattle, to grow crops, but it can never be developed. And the more of that we can preserve into our state, it not only adds to the beauty, but it protects our environment because it is a sink for a lot of the water that we have running off. And it's important for us to study that as well, to make sure we're up on what we call the B maps, or how the water drains through our state, and make allowances for the pervious area that we have when we have growth.
Now, how would you work with local officials and county commissioners to ensure that our county's interests are represented at the state level?
One of the biggest challenges we have as human beings is our communication with each other. To being open, I think, to being integrous is key to that, to being able to accomplish things. I often try to give everyone the benefit of the doubt and have an innate trust for someone that wants to go into public service with the skepticism to look at what their actually intentions are. And the best way to open communication is to have an open door. Another thing that I think is very important is to be empathetic. You need to study the issues and have an understanding of where each individual is coming from in what they're doing and their objectives, as well as integrating county policies with state policies. We want to make sure that we look at the benefit of the community and the state as a whole whenever we craft any policy that may infringe on home rule.
Okay, one more quick question. As a physician, how would you address healthcare access disparities, particularly for rural residents in communities that may lack sufficient medical infrastructure?
That's a great question, and the answer is a little bit long, but I'm going to give it to you as concisely as I can. I believe healthcare starts with education. What we've seen in our communities today is a real unhealthy lifestyle. Our children tend to be somewhat addicted to more a sedentary life. They're using social media and cell phones far too much, and we've made some steps to try to curb that. Also, diet, I think, is extremely important. And we need to try to curb obesity, which is becoming a large problem, not just for Florida, but for our country as a whole. And if we do that, we're going to reduce costs and healthcare consequences as we age as a society. Also, we need to continue to increase educational opportunities, particularly for postgraduate medical education, by opening up more residency programs in our hospitals, particularly our community-type-based hospitals, to where physicians will then be trained and stay in those communities so they would be able to continue to engage the community where they've been able to train and serve. Also, the paramedical type professionals like the nurses, lab techs, physical therapists, etc., need to continue to have access to training as well as then experiences in the particular clinical setting where they're going to be working.
Ralph, thanks again for participating today.
It's been my pleasure. Thank you, Mike.